During try-in, it sometimes happens that an orthosis is found to hold in place in a sufficient and acceptable way. Composite buttons can be unnecessary at that moment, but they might become very useful if the patient subsequently complains about one of the splints of the orthosis coming off during sleep. This can happen frequently with bruxism patients who make large sideways movements during sleep. We will simulate the addition of composite buttons. Here, it will be done on a plastic model, which will be almost identical on the patient's teeth. We suggest that you start with the application of only one button at a time in each quadrant. We begin with the etching of the enamel on the entire buccal surface of the tooth on which the composite button will be placed. Then, we thoroughly rinse with water. We apply a composite adhesive with or without polymerization, depending on the type of adhesive you use in your practice. We choose any preferred composite, except liquid composite, which will not hold properly inside the acetate. We apply a small portion of composite paste to fill the concavity of the button inside the acetate while ensuring that there are no bubbles. We must, however, have a slight excess so the button can adapt properly to the surface of the tooth. Then, we put the acetate in the patient's mouth. We press firmly where the button is to ensure that the composite material adheres well to the tooth. And we polymerize through the clear splint. Once the first button is in place, we remove the acetate from the patient's mouth. We can clearly see here the bubble-like shape of the small composite button. Before repeating the same operation for the next button, we can already check in the patient's mouth to see if the splint of the orthosis holds properly on the side where the button was placed. Which is the case here, where we can see good retention, while on the side without button, the splint is looser. We proceed in the same way to set up the other buttons, if they are necessary, to ensure proper retention of the orthosis. For each button made, we will remove any excess composite that might have slightly overflowed the location of the button. Polish as a finishing touch. And lastly, make sure that the upper and lower splints are properly retained on the patient's teeth by the new composite buttons.